ahead and start the meeting. We have enough members here to start that creates a quorum. So I want to welcome everyone here to the Silver State Health Insurance Exchange. This is our properly noticed meeting for April 11th. We're teleconferencing between the College of Southern Nevada here in North Las Vegas and the Silver State Health Insurance Exchange up in Carson City. I don't have any announcements this morning or this afternoon. Are we able to mute those that are calling in and then open it up for public comment when that time's appropriate?
Yes, I think so. I'm going to defer to Shauna. Do we have is Ms. Johnstone on the line?
I am.
Great. And Mr. Roos, is she on the separate line so we can mute the public line? She can participate and then we can unmute it for public comment?
Yes.
Great.
All right, thank you. That'll be our only announcement then this morning. With that, I'm going to open it up to public comment. And is there any public? Oh, yeah, thank you. Thank you, John. Let's go ahead and take roll call.
So Ms. Johnstone indicated she is here by phone. Ms. Lewis?
Here.
Dr. Klein?
Yes.
Ms. Kerr?
Here.
Dr. Ford?
Here.
Director Wilden? To be absent. Commissioner Kipper? To be absent. Director Mullenkamp? Also absent. Vice Chair Atkins?
Here.
And Chair Campbell?
Here.
We have a quorum.
Thank you very much. All right, then jumping ahead to agenda item number 2 for public comment. Do we have any public comment in Carson City?
Not approaching.
Thank you. How about here in North Las Vegas? There's none. Anyone on the telephone? And if there is, please identify yourself for the record. All right, with that, we'll close agenda item number 2.
Before we do that, I just want to make sure the board understands that there was public comment submitted, written public comment from Liberty Dental.
Okay.
And that's in your packet.
Thank you. All right, moving ahead to the approval of the minutes of March 14th and then March 27th. Are there any amendments, comments, or changes to those minutes? There being none, do we have a motion to approve both of those, please?
I move approval of the minutes of the date indicated.
All right, thank you. Ms. Lewis has moved, and is there a second?
I'll second.
Dr. Klein seconds. All those in favor?
Aye.
Aye. Any opposed? Motion carries. We'll open agenda item number 4, the Executive Director's report. Mr. Hager.
Good afternoon. For the record, John Hager, Executive Director. So the Executive Director's report includes the status of exchange implementation and specifically federal regulations. A lot of the federal regulations that you see in this report are the same as that were provided last time. We did submit comments regarding regulations for exchange functions, eligibility for exemptions, and miscellaneous minimum essential coverage on March 18th. There are 5 more regulations that for which they have requested comments. The most important of which I think is the navigator and non-navigator assistance personnel. Those comments, it's the last item there where we say it'll be due 30 days after the regulation is published. That date has been set for May 6th. So so we will work to get those regulations completed, or those comments completed. The other 4, we're looking through them. It doesn't appear that we, well, actually there was one that was due that the comments were due April 1st, and we did not submit comments for that one. We didn't feel it was necessary. There's 3 more coming up, 2 more at the end of the month, and then 1 in June, and we'll review those. We're not sure if we need to provide comments for those ones. Technical implementation. The Exchange and Xerox have completed the rack sessions for Rack C on schedule. You'll also notice that if you look at the quick look provided as the attachment, we are caught up. There were 5 items that were 3 of them were slightly behind, and 2 were fairly far behind. Those items have been caught up, so you'll see that we are caught up in all areas at this point. The Rack C requirements and configuration sessions were ahead of schedule, and we're working on getting those final documents prepared. Xerox is working on that for staff's approval. There are 2 other items to update. If you recall, we brought an item to the board last time about possibly merging the call centers. After an extensive cost-benefit analysis, the Division of Welfare and Supportive Services determined that it would cost too much money to use the Xerox solution for their portion of the call center. So we're going to keep our call centers separately, and we're working at this point on how to merge those call centers, risk mitigation plans, and all that kind of stuff. So we'll get through that, and we're moving forward with that. One additional item. The IVNV team has identified one risk, and if you recall, the public consulting group is the IVNV team for both the eligibility engine and for the BOSS solution. Both teams individually identify risks on their own and create mitigation plans. We have a few minor risks that they're concerned about falling behind, and they've got active mitigation procedures in place to increase resources to those various items, and staff is satisfied that those items are covered. Nothing that the IVNV team has seen on our end. On the eligibility side, IVNV team has identified one risk. It relates to the requirements and traceability matrix. That is a document that is provided to allow the build team to say, all right, if there is a change that we create over here, let's trace it through the system and figure out where it comes out on the other end, so we make sure that we've thought about everything. The IVNV team is concerned about the documentation for that risk traceability matrix, or excuse me, the requirements and traceability matrix. The eligibility engine team understands that it is a risk. The individuals that are on the team that are designing that part of the system are comfortable with it. The concern, of course, is if you take people off of programming to write reports, then you're not programming. So we will keep an eye on that. It should be completely mitigated within 2 months. What the IVNV team says is they can't tell whether it's a risk or not, so they've flagged it as a risk. It appears that it's going forward okay. The eligibility engine team, the welfare team are comfortable with it, but I wanted to bring that up to your attention. Carrier onboarding. We had our 3rd and 4th carrier onboarding meetings on, and I should say, April 3rd and April 10th. We are also scheduling several meetings one-on-one with the carriers as they request them. The meetings are scheduled to end, I believe, May 15th, and those are going fairly well. There's a lot of good dialogue between the carriers and exchange staff, the choice team and Xerox team. Some of we're working through the eligibility issues and eligibility rules, but for the most part, there's some good communication between staff and the carriers. The navigators and enrollment assisters, as I mentioned earlier, there was a regulation that the comments are due May 6th. The regulation indicates that navigators for the federally facilitated exchange and enrollment assisters from state-based exchanges, because they're paid by establishment grant funds, have to follow HHS-approved training and testing. That's a concern for us because the navigator and the certified application counselor programs are designed to take the same training, and now there might be a different type of training required for the enrollment assisters simply because they're paid for establishment grant fundings. We disagree with that comment at the staff level, and we'll provide those comments to the chair and the vice chair to review before we submit those. But to us, they are all 3 enrolling people. They should follow the same standards that the state of Nevada has to make sure that our consumers are protected. Simply because they get establishment grant funding, we do not think that HHS should dictate their training, especially when that that was not a requirement of the funding. When we got the funding, there were no strings attached to the funds that we requested for enrollment assistance, and now suddenly there are. So we're concerned about that. We're also concerned that it says up to 30 hours. Our program is we're designing a 20-hour course with some additional, a 20-hour certification course with some additional training that the exchange provides for web portal and general things of that nature. Our concern is that the HHS standard might be a 30-hour course that, and how that works. We think that it's very likely that HHS would simply say that we certify the course. It's good enough, but you just never know. So we're concerned about that.
When will they have the course certified?
We don't know. The regulation comments again are due May 8th, May 6th. Then there's a period of finalization for those comments, and then they would have they'd have to create some kind of a certification process for the course. So it's up in the air. My guess is that they would push to get this done probably by around the July timeframe, but we planned on starting our training in July. So again, we're concerned about it. We've talked with the Division of Insurance about it, and we will work through that. The application instructions for grants for navigators and enrollment assisters, that was published. There were 100 questions that were asked of the exchange. We answered those, posted them online for the respondents. This document here is incorrect. There were actually 41 responses received by the April 4th deadline, and staff has been going over those applications over the last week to provide notes for the selection work group, and so we'll take a look at those. The selection work group will take a look at those on April 29th, and we'll present the selections to the board on May 9th. I'm sorry, say that again? So the work group consists of me, Ms. Campbell, Ms. Johnstone, and Mr. McCoy, excuse me.
Okay. So, Ms. Johnston's our Las Vegas.
Yes.
designee.
So Ms. John was the only one from Las Vegas that volunteered last time.
If you recall, we asked for volunteers on it. And, we had a hard time getting
No,
volunteers.
I'm going to be out of town, that's why. That's why I didn't fit. So,
I can't do it.
You cannot do it?
has the work group started yet?
No.
I'm just wondering if maybe you wanted to reach out to some of the consumer assistants. I don't know, Timmy would be interested, some other folks.
The difficulty is that some of those applied for
Yeah.
grants.
I just would love to try and give another base. And I would normally do it if I can't.
What is this, a one-day thing or?
It's a one full day.
Well, it's a one-day selection committee. We're going to provide the documents to that work group tomorrow to give you plenty of time to look at it, but it's going to take a significant number of hours to go through it.
What day is it, the meeting?
The meeting's on Monday, the 29th
Oh.
of April. Mr. Roos, about how many hours would you say that staff has looked at the applications at this point?
Mr. Hager, for the record, this is CJ Bowden. Mr. Roos let us know that we requested a representative from the Department of Health and Human Services as well, and we did not receive a response from that. And we're estimating probably 40 to 45 hours in total commitment time to go over the applications that were received.
Thank you.
And also, John, for the record, Damon Haycock, just for the roll call, Commissioner Kipper has arrived from the Division of Insurance.
Thank you.
That's right, so the 40 to 50 hours is from tomorrow through April 29th.
Correct. And then April 29th, we'd actually get together for the day.
As a suggestion, I don't think that the work group is closed. If we have some other member or some qualified person to sit as another member from Southern Nevada, why don't we ask staff to see if we can seek that person out? With that,
Yeah, I love, it's getting kind of late, I just,
Certainly. That's like so the people will
I'm just
be
trying to think from
remotely
like,
prepared.
yeah, I'm trying to think of the finance committee, if there were folks from the staff that wouldn't have a conflict.
We could reach out to them.
I mean, again, it just goes back to the same thing we discussed where, 85% of the, enrollees are gonna be in this, and I get that we opened it up to the board, there was only, south. I think we should make it.
Thank you.
If you're on the telephone, then please mute your telephone. We can hear you again.
What's the area code?
Maybe
So,
okay, we'll go back on the record. Thank you very much.
Can the public hear us?
Yes.
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 Great.
Okay, thank you.
So moving along.
Yeah, so moving along with the executive director's report, we were talking about the work group that's going to be looking at the grant applications. And Ms. Atkins offered to help round out that work group. So I think we've resolved the issue that she brought to the table. So, Mr.
All right.
Hager?
So our list of upcoming deadlines is on the bottom of page 5. The grant selection committee is, as I said, April 29th, not May 2nd. The plans need to be submitted, the QHPs need to be submitted to the Division of Insurance by June 7th. Also, the Southern Nevada Exchange Summit will be at the JW Marriott on the west end of town here for Las Vegas on June 14th, so we hope we can have everybody there to join us. On the next page, Plan Certification and Management, we have one more meeting of the Plan Certification and Management Advisory Committee on April 18th to discuss network adequacy. The Division of Insurance should have some recommendations at that point. We'll bring that to the board at the April 24th meeting, which is typically the meeting for legislative updates, but we need to add that item on network adequacy so we can get it out to the carriers by May 1st. So just to keep that on everybody's radar. Now, fortunately, the legislative update should have not a whole lot of additions to it, so it shouldn't be as involved in discussion. Will be just a general status update, similar to what you're going to have in the next agenda item. Consumer assistance, we don't want to say that the work is complete yet until we are sure what the regulations are for appeals and how we work through all of that. But pending any major items for the final regulations, it appears that their work is complete. So you can see the committee calendar, board calendar, on pages 6, 7, and 8, and the page 9 is intentionally left blank.
Do any of the members have questions for Mr. Hager? All right, with that, then we're going to move ahead to agenda item number 5, which is an update on the legislative bills that may have an impact on the exchange.
For the record, John Hager. So when we move to page 2, and you'll see this throughout, any changes that from the previous report are included in basically track changes, red, strike through, blue, italics. If you can read that in black and white, great. But strike through in italics. So Assembly Bill 65 was amended and passed out of committee. The amended language, actually, it is in Nellis. It's not provided on some of the other web pages at the legislature, but will be soon. But the amendments do not appear to affect the exchange any more than the original language does. So there's nothing additional for that item. Assembly Bill 220 that prohibits fees relating to credit card transactions. We submitted a fiscal note that we talked about last time. The only real change to this one is it is eligible for exemption, but it does not have a hearing scheduled. So if it becomes exempt, then it will be able to go forward through the process, or if it gets passed through the committees. The last day to get passed through the first committee is this Friday, unless it's exempt, and then there's some additional timelines. Usually the exemption only occurs for items that have fiscal notes or budgetary impacts. Assembly Bill 251. The bill was amended and passed out of the committee. The amended language, I'll read it for the board here. I don't think it is, and of course my iPad decided to update right now. I just got to find the right page. So basically, the amended language is not nearly as concerning, I guess, as the original language. What it says is that basically that the exchange would be required to provide to the public a phone number. Let's see, a member of a public body or the public body must provide a means by which each member of the public body can be contacted by a member of the public on an individual and confidential basis through either an individual telephone number, individual mailing address, or individual email address. If the public body provides a means of contacting its members individually, the individual phone number, mailing address, or email address must be for the use of an individual member and not a general address, phone number, or email monitored by the public or accessible by other members. Nothing in this section shall be construed to require personal contact information provided by a member of a public body to the public body for its use in contacting the members of the public body be disclosed to the public as a public record. So I think what they're trying to say is we should provide you with some kind of contact information, a contact information for each of you individually that you can monitor, so that members of the public can have a confidential discussion with you and not necessarily have their comments be provided on the record or in public. And I think that it kind of goes, you know, if I'm doing something wrong and they don't want to go through me, or they fear reprisal from me, they want to be able to contact you separately. So
it seems like one thing we could do very easily, even if this bill doesn't go through, would be to give all the board members an email address through the exchange that we then forward to our personal emails. That keeps our personal emails personal and also lets us get that information.
We can look at that if you'd like. Post it right on our website for everybody to use.
Sorry?
We'll post it right on our website for everybody to use. Sure.
It's not a big deal to me.
Yeah.
Yeah, with the doctors.
I think that the bigger concern, it's less of a concern for a board like this and more of a concern, I mean, certainly for doctors, you don't want people calling you in the middle of the night when you're not on call. But for boards that have to do with public safety or corrections or something like that, I could see that should be separate. Assembly Bill 267 revises provisions relating to legal notices. The exchange submitted a fiscal note and a suggested language to remove the fiscal note. It has been deemed eligible for exemption, but it has not passed any House at this point. Assembly Bill 369, we submitted a fiscal note for this item contingent on certain assumptions. The issue is that we don't really know what this is going to cost on a per member per month basis. Testimony provided at the hearing, though, from the proponents of the bill indicated that it would cost between $4 and $10 to $20 per member per month, and so we said that if the cost was 0.1% of premium, that would be about 30 cents per month, $300 premium, 30 cents per month, so $360 per year. If you added that all up, the cost to the state would be $188,000 in fiscal year 14 and $417,000 in fiscal year 15, with a total of $921,000 for future biennia. So the reason that would occur is because it would be a state mandate on top of the essential health benefits that the state would have to pay for that the portion of the APTC that would otherwise be attributable to that cost. So I think we talked about this in a previous meeting. We are building this system so that we can take this into account, so that the technical build will be there, and it's just a matter of whether or not this bill or the acupuncture bill is enacted to determine whether or not that will be an issue. Again, fairly hefty fiscal notes on both of those because of the Affordable Care Act and the requirement that the state pay for those new mandates. So that one is, there has been one hearing, there's no action. and I thought it's eligible for exemption. I don't think I have that down here, but AB 425 is the Division of Omnibus Bill that certifies navigators, enrollment assisters, and certified application counselors, aligns state law with the Affordable Care Act, and allows the Division of Insurance to monitor network adequacy. That one, I believe, is scheduled for hearing tomorrow. Maybe Commissioner Kipper could say yes or no?
Yes.
Tomorrow?
Yes.
Thank you, sir. So we'll see how that one goes. And I would imagine it I guess it's scheduled for work session tomorrow. So Assembly Bill 489 is a new one on here. There is a fiscal impact. This one requires state agencies to charge $2 per credit card transaction for any transaction greater than $50. It's not thin, it's not less than, or up to, it's $2. So based on our current path of charging a credit card fee, passing that fee to the consumer, we estimate that would cost us about $1 million in fiscal year 14 and $2.3 million in fiscal year 15, for a total of $5.2 million per biennia in the future. So we would like a recommendation for that one. And I'm not sure if we've got the fiscal note on there, so I think that provides our position. The concern is that we made it very clear that general fund dollars we're not expecting general fund dollars from the general fund, so this would cause our costs to increase significantly.
I'm confused. The people the policyholders who pay with credit card, they get charged $2? Or we pay $2 every time you use a person? I don't understand.
This is convenient.
So so currently the way we have set up the policy that we've so let me back up.
That's my point. Why does it cost us money? It costs the person who's paying money to charge $2 extra.
Right. No, what this says is you'll charge that the convenience fee can be no more than $2. Okay. So if a typical convenience fee is, say, 2%, so 2% of premium of a $300 premium is going to be $6. We have to charge $2. We have to eat the other $4. So if we eat the other $4, we have to increase our fees. And so therefore the carriers will have to increase their fees, and will increase the cost to the consumer.
Now that contradicts the other bill that says you can't charge credit card fees.
Yes.
So if they both pass, that would be interesting.
Welcome to the.
Yeah. I guess my thought would be on this, is there any way we could ask to be exempted from it?
We could do that.
And note our fiscal note.
And by being exempted from it, that means that we would charge more, whatever the fee is for the use of that particular card.
Right.
And the fees are I know they're different for each card. Is it on average about 2%, 3%?
About 2%.
And
maybe a little bit less, maybe a little more.
So a $500 a month premium is $10 a month, so $120 a year.
So it's very likely that people will not use credit cards for the most part.
But we think the electronic fund transfer, there's no fee. That kind of thing we had talked about last time. Or
so every transaction costs money, whether it's 10 cents or 5 cents or 20 cents. Our contract with Xerox, Xerox will absorb those fees, but they're not going to absorb the merchant fees, which are the 2%, the credit card 2% transaction fees.
So you have two fees going on. One that's charged to the exchange, the 2%, and then there's the convenience fee, where we can recoup that by charging either the carrier or the policyholder. And our budget has been built on the fact that we will charge one or the other, right?
That our budget has been built on the fact that we would charge a convenience fee to the consumer, or not allow credit cards at all. Since the board has said we're going to allow credit cards, but there's no convenience fee, that's where we're moving forward at this point. Now, there is an item to discuss that later, but after mulling this over with staff, we had lots of debates, lots of hours of debate over the credit card issue. We think that it's too late to change it right now, and if we want to make a decision to change that maybe for 2015, but we're too far into this process. The carriers are pretty far along in setting their rates. We also don't want to appear to be unstable. If we are too unstable or too wishy-washy, it may be that people say, you know what, I'm going to wait a year and see how this thing goes before I start participating. And so I think the fact that we have provided, we've been out in front, that we provided stable recommendations, that we haven't done a lot of changes. I think the carriers appreciate that and are willing to listen. I think at this point we're looking at 6 to 8 carriers participating, which I think is going to be great. But if we start messing with these things for 2014, I think that we could lose some of those carriers.
John, this is Marie. So how would we go about requesting an exemption? Is that something staff could do for us upon our vote to request that?
Absolutely.
Okay. Can we? Silly question time. Can we do the motion at this point?
Okay, so I just want to make sure I'm on completely the same page. So the proposal right now, or the chair's suggestion is to potentially exempt us out of the no more than $2 cap for the consumer pay on the credit card transaction. We have our contract with Xerox that has the fee, the transaction fee built in, rather than a convenience fee. I guess those are 2 different fees we'll call it, right?
Right.
And that's already built in.
Yes.
And so exempting us out of this potential statute will keep everything status quo based on how we thought we were going to move forward.
Yes.
And if we're not exempted out and we don't change the fees, where does $500,000 come?
It comes from our reserve initially until we deplete the reserve, and then we increase rates.
Right.
Yeah, well, now actually, theoretically, because it's an operating cost this first year, it would come from the establishment grant funds. But we're getting to the point where if we add too much more cost, we're going to have to request additional establishment grant funds. So we would potentially have to request more. And then after that, we'd have to raise rates.
Who is the sponsor of the bill?
I could find out for you.
I mean, the sponsor might be amenable to.
And again, there's no convenience fee for electronic fund transfer. There's just transaction fee that's built into Xerox.
Correct.
So,
and could you guys, excuse me, can you please identify yourself for the record so that
sorry.
the transcriber can, thank you.
That was Lynn. Okay, so however this ends up, at some point, I would love for the board to see a mock-up of the page where consumers are told, here's your options, here's how much it's going to cost to use a credit card, here's how much it's going to cost to use electronic, whatever the disclosures are and the clear, transparent, I'd love for us to see and approve a mock-up of that page or that process.
Okay, is that there's hundreds of pages in the eligibility engine, so
wherever they're planning on it, I guess. Wherever, you kind of go through a transaction, and at some point you're told.
Let me interrupt you for a minute, because the action item we're on is just the legislative update, and maybe this discussion might go on possible other agenda items, just so that we
can
just
talk
wanna make
about it
sure
in the
that-
credit card one, I think.
Yeah.
I want to say that here.
Okay, so do we want to, does the board want to move ahead with the possible exemption to this bill?
I think it's a good idea.
Do we need can I have a motion
This
on
is Dr. Ford. I move to instruct staff to request an exemption from this bill.
Dr. Klein, I second.
All right, all in favor of the motion?
Aye.
Any opposed? Motion carries. Thank you. Let's move on to Senate bills.
Senate Bill 156 requires coverage of acupuncture. Excuse me. This fiscal note was submitted by the Division of Insurance. It has been noted eligible for exemption, but besides the first hearing, there's been no other action. Senate Bill 266 requires coverage for orally administered chemotherapy. That bill was amended and was passed out of, I believe it was Senate Commerce. One of the amendments moves back the effective date for all plans to January 1st of 2014, and for any qualified health plan would move it back to January 1st of 2015. So they were amenable to our concerns about the carriers being able to make these changes for our plans by the going through the certification process currently. Senate Bill 318 requires an interim study concerning claims, coverage, and payments under policies of dental and health insurance. There's been...
Sorry, John. I know, they already did what they did. I apologize. So if, God forbid, you get cancer in 2014 and you have a qualified health plan from us, then you won't get coverage for your oral chemotherapy. But if you're not done through the exchange, then you would have. So, I mean, I'm just sort of envisioning that scenario. That's bad news.
However, for the record, John Hager, the essential health benefits requires that every formulary include at least one drug from each category and class of the U.S. Pharmacopoeia 5.0 guidelines. And so I would imagine that at least some of the chemotherapy drugs are covered in the EHB.
Well, I mean, they don't have to be. I mean, you can cover them at 10%, you can cover them at 100%. So I'm envisioning a bad PR situation where somebody has a
apparently they'll go on like, what's going on? The meeting's on. I thought it was over, but
Those on the phone, could you please mute?
I hope it never happens, but I'm envisioning a bad PR situation where somebody buys a health plan, pre-HP through the exchange, and they're not covered where everybody else in the state who didn't buy through the exchange is.
This is Dr. Ford. What I didn't understand when I first heard this bill is since it's fiscally neutral, that to me implies it's somewhat redundant and unnecessary. So I'm not sure what drugs we're talking about.
There are drugs. There is a big issue in oncology where more and more of the drugs that we use, that you have to use because you have no alternatives, are oral drugs. And sort of a remnant of, previous 30, 40 years when oral drugs were amoxicillin, insurance companies make a distinction between covering oral chemotherapy or covering oral medications and covering IV medications. So there are people right now who need certain meds. If you have CML, chronic myelogenous leukemia, you need to take Gleevec. That's $4,000 or $5,000 a month. And that might not be covered by your insurance company.
Right, but what I never understood when I first heard this bill is why this issue was fiscally neutral, why it was zero. To me, that meant that these drugs were already covered in the existing.
The state is neutral. I think in Massachusetts, they have 21 states have adopted this. And the estimate is 0.01% change to premiums by virtue of covering this. I think that was the number.
For the record, John Hager, the Division of Insurance and Exchange looked this over, and it did not appear to require any additional coverage beyond the essential health benefits. Now, I don't know about cost sharing and how that would apply, but there's no provision to pay for any cost sharing differences. It's simply about what benefits are covered beyond the essential health benefits, and based on our analysis, it appears that there's no additional cost to the state for the advanced premium tax credit. There might be, if it's a cost sharing issue, and I can't recall this one.
It is a cost sharing issue. So the point is that if what this bill does is it eliminates the disparity between cost sharing, whether you're getting oral chemotherapy or IV chemotherapy. It eliminates that cost sharing differential. So they're covered, but there's a cost differential. So again, I mean, maybe it'll never happen, and I'm just it just would be bad if somebody said, well, geez, had I not bought the health insurance plan under the exchange, I could afford my chemotherapy, but if I bought it through the exchange and there's just 1 year difference, I got to pay $5,000 a month, and I can't pay $5,000 a month. That's what I'm concerned about. But I mean, it is what it is, but that's just my concern. Okay.
All right. Mr. Hager, do you want to move on to the next?
Senate Bill 318 requires an interim study regarding policy of dental and health insurance. There have been 2 hearings with no action. Senate Bill 352 would add 2 additional members to the board. There was 1 hearing. There was no action taken on that one. And staff provided a neutral position, or indicated the board did not take a position on this bill, and answered questions from the committee.
John, this is Marie. I've been thinking about this one, and it strikes me that it may be not looked on well by the public, and perhaps perceived conflicts if a health insurance carrier is involved in the board or has a vote on the board. Can we possibly, is there some way to suggest that the 2 additional members, I think it helps having input from the health insurance carriers. And the broker community, they've been very helpful and they have a lot of information to give us. But maybe like some sort of advisor status, or kind of like Mr. Molenkamp, ex officio, is that what you call a non-voting member? Mm-hmm. That might be a better status for such persons. How would we go about requesting that, and what do the other board members think about that?
So if the board directs staff, we will submit an amendment that would request that they be non-voting ex officio, or non-voting. I'm not sure if ex officio is the right term for if they're not the director of commissioners, but
by virtue of your office, so this would be non-voting.
But we could submit that amendment if the board would like us to.
I'll tell the board members that both John and I have been working with some of these different industry groups that have had some really large concerns about what the board is doing and whether or not we're acting in a predatory manner, things of that nature. Their lobbyists have contacted both John and myself on this, and both of us have given them the direction that the board gave us last month, is that, whoever the governor wants to put on the board or the legislature wants to put on the board is fine with us. We only ask that they give us qualified people that don't have a political agenda. I don't know, changing that statement at this point in time, would be, I just want you to know what our discussion with these individuals has been.
I think even though, and we may have strong personal feelings, I think for the exchange, that's probably the best position to take.
This is Lynn Atkins. I forget, does the Affordable Care Act have guidance on this issue?
It does. The regulations, it requires that at least 1 member be a consumer advocate, which we have on the board already. It requires that if there are individuals who are represent insurance companies, that there be no more than, it can't be a majority of members. It has to be less than a majority. There might be one other requirement, but generally the board structure currently follows that, except for the regulation. The federal regulation allows insurance representation as long as it's not a majority, and our current statute does not allow insurance representation.
And other states do allow that representation,
yes,
too, so that we're a little unique in not allowing them at this point in time.
I don't, for the record, John Hager, I don't know if we're unique in that regard, but certainly there are states that do have significant insurance representation.
It just strikes me, this is Marie, that there are conflicts inherent in such positions on the board. And the other thing is that it would give one insurance company or one member who has experience in the insurance industry, I'm assuming that means probably a broker, either a perceived or an actual advantage over others who are similarly situated who don't have a voting position. And it just, those are my misgivings about it, and I wanted to voice them at some point. So there they are. And, you know, the board has the ability to recommend or not recommend, and I do think that the contributions of industry are extremely helpful, again, and we rely on them to give us the information we need. On the other hand, I don't want the public to perceive the board as being influenced in that way, rather than receiving information, having voting rights on the board. So with that, I leave it up to the board to do the to do what recommendations we will, or not.
This is Lynn. I agree with everything Marie is saying. I think it's one of those odd positions or bills that comes up that, since we're board members, it just seems odd to me for the exchange necessarily to take a position on this. I guess it seems counterintuitive. Again, I agree personally with what you're saying, and I would not want the public to perceive that a particular industry had influence over the board as well. And I think there will be perceived and actual conflicts. So I agree with all those things. It just seems a little odd for the board to, maybe be taking a position on who could be on the board.
I think there are a lot of outside groups, Marie. I agree with you personally as well. I think there are outside groups that are taking positions on this legislation. The Nevada State Medical Association will oppose. Southern Nevada Medical Industry Coalition will oppose. But I agree with Lynn that probably for us officially to remain nonpartisan on the issue probably serves us best.
All right, so unless a board member wants to make a motion to change our current position, which is that the board will do whatever the legislature and the governor request of us, we'll move on to the next item. Marie, do you want to make a motion?
No,
to change your...
No, I don't think, given what I'm hearing, it's probably not a good idea. On the other hand, I did think that we needed to, or at least I needed to, publicly state my misgivings about this particular provision. And it does seem that if that with the Nevada State Medical Association and other groups opposing that there is a voice for it. So I'll leave it at that.
All right, Mr. Hager, then let's move on to SB 359.
SB 359 directs the exchange to direct marketing to uninsured and underinsured. And that one has had one hearing, and there's been no action. The amendment was submitted by Senator Roberson to the Senate Committee on Finance, and we'd have to wait to see how this goes forward at a future work session.
And just so the board knows, both John and I testified at that hearing yesterday, and told the Senate that we were in support of that. And John and I both have been working with some of the industry group with the insurance brokers to kind of calm the misinformation that's out there regarding the exchange.
Senate Bill 408 requires a state agency to conduct a performance review of certain current or expired privatization contracts. So in this case, the exchange's contract with Xerox. Theoretically, many of the things that Xerox does could be performed by state staff. For instance, the call center could be done by state staff. This requires a performance review that will include a cost-benefit analysis and assessment of the performance of the contractor, a comparison of anticipated service levels to actual service levels, and a comparison of anticipated savings to actual savings. We have estimated that that kind of report would cost as much as $125,000 each biennia. That item was it was passed out of committee. It is exempt because of all the fiscal notes that are attached to it and referred to Senate Finance. And for this one, staff recommends that you direct staff regarding this item.
How would staff like to do it?
Staff doesn't know. This would obviously, this could potentially add cost. Now, compared to the millions of dollars of some of the other ones, it's not a huge cost. And what we decided that is that we should be doing some of these analyses anyways. We need to be monitoring the contract, et cetera. So I don't know if what we should be doing and what this required. I don't know where the gap is between what we should do already and what's required by this bill. I think that there are significant fiscal notes on it that speak for themselves, and so I don't know if a position is necessary.
Then maybe the direction of the board is that you continue to monitor and update for us.
This is Dr. Ford. Do we, when do you think you'll have a plan in terms of what should be done in terms of monitoring? You said there may be a gap. So I'm more concerned about what should be done. So when do you think you'll Xerox and you will have a sense of what should be done in terms of monitoring?
Well, we are already setting up a bunch of various metrics to monitor the call volume, the time to answer, the call times, so that we'd have a better handle of, once we have that data,
right,
be able to say, all right, if state staff did it, this is what it cost. If we bought the technology, this is how much it would cost. I think that you wouldn't be able to make a good comparison until you have maybe a year's worth of data. Our contract, of course, is in place until December of 2016 with an option to renew for another 3 years. I think that the direction that we've moved at this point to having this outsourced to Xerox makes a lot of good sense, considering that we're brand new, starting up. It might make sense in the future to insource this item once we've got a better handle on what we need to do. Of course, that would require a whole nother layer of support at the exchange level, the personnel and the call center staff, et cetera. That's not to say that we couldn't do that, but I think it would take a year or so before we could really have a good idea of how much that might cost the state or the exchange to do that.
So this is Dr. Ford again. So at the time of the renewal is when you'll be doing this analysis.
Yes, well, before renewal, yes.
Right.
So we would
in preparation for renewal, you will be doing this research and this data crunching.
That would make sense. And I don't know if we would do all of this, but certainly
what you need to do.
What we need to do to decide whether or not we need to extend the contract or go out to bid again or potentially insource it.
Okay. Any other comments on?
I think just staff monitor.
Okay.
Come back with additional information sometime when we have more information.
Ms. Kerr, do you want to add anything else to that discussion?
Nope, nothing to add to that discussion.
Okay. And Ms. Johnstone, I don't mean to ignore you there, but jump in if you have anything that you want to contribute to any of this legislative report.
Thank you. I'm fine.
Okay. Then let's move on to SB, what are we, 418?
There's been no change in status for 418. It appears to be tabled still. Senate Bill 454 is the exchange bill. There were 2 hearings. At the last hearing yesterday, it was amended and passed. The amendments, so 2 of the amendments, so the board recommended that we include 2 amendments. The one that deleted the word pediatric was actually changed through negotiations or discussions with industry. So there is a section that allows the exchange to explicitly offer explicitly offer dental and vision products. Standalone. So that is provided in there, and that gets to the intent of deleting the word pediatric. So that's the first part. The second part was that any supplemental product beyond that, if it's regulated by Title 57 and the Commissioner of Insurance, that he would approve that offering, and that we could potentially offer other services such as HSAs, HRAs, if it made sense to the board and the public and everything. But the idea is that that products would be offered through the exchange. We're facilitating the marketplace, that we would be a marketplace for competition, not a competitor in the marketplace. And then one amendment was submitted by the Division of Insurance to adjust the language for the tax exemption for carriers to match the tax exemption language found in other sections of Title 57. The intent was the same. And so with that, that's the report for Senate Bill 454 and the entire legislative update.
All right. If there aren't any further questions for Mr. Hager, we'll close agenda item 5 and move on to agenda number 6.
For the record, John Hager. Agenda item number 6 makes changes to the bylaws. The first item is on page 1, Article 2B. It eliminates some of the old language that was basically the board getting through shift from the paper disclosures to the electronic disclosures. So that is now in the past and struck from the bylaws. We changed the SHICs to the exchange. Article 4 is all about me. We had section A. So, it's all about me. Section A takes the discussion that we had at the board level last month about reviewing the performance of the executive director and provides the standards that the board will measure me on. And that will begin in the second quarter of each calendar year beginning in 2014. And so this basically matches the board's instruction from last time. So there's really nothing new. It's just putting it in a different format. Section B and C provide specific authorization to me to help me do my job, and specific boundaries on what I need to be. I need to make sure I keep you informed on and what I bring back to you. So the administrative functions. It reads: the board authorizes the executive director or is designated to carry out all administrative functions of the exchange, including but not limited to providing official press releases and to answer questions from the press and other news media, prepare and submit the agency request budget and work programs as necessary to carry out board policies, financial management of all billing, accounts receivable, accounts payable, and budgetary compliance, management of all agency personnel, selection of vendors and negotiation and execution of contracts and contract amendments necessary to fulfill the requirements of the Affordable Care Act, its regulations and guidance, state laws and regulations, and the policies of the board, management of all vendors to include monitoring of contract performance and compliance, negotiation and execution of memorandums of understanding between the exchange and other state and federal entities necessary to fulfill the requirements of the ACA, its regulations and guidance, state laws and regulations, and the board and the policies of the board, interpretation of the ACA, its regulations and guidance, Nevada Revised Statutes, the NAC, in performing all functions of the exchange, representing the exchange to other federal, state, and sovereign entities. And typically when we've been sovereign entities, we're talking about the tribal entities, including all branches of government. And then the boundaries on section C on page 4, the director shall ensure the implementation of the exchange is on time, on budget, and conforms with the policies of the board. Inform the board of any major implementation risk that has the potential to delay implementation, cause a significant increase in cost, or cause a policy of the board to not be implemented. Ensure the exchange is managed so that it meets the goals, objectives, and measures of the strategic plan. Provide for a review by the board of the strategic plan and bylaws in the second calendar quarter of each year. Provide for a review of the committee recommendations approved by the board no less than annually. Ensure contact with the press is conducted in a manner that maintains Nevada's leadership position in exchanges and does not alienate stakeholders. Notify the board immediately if the employment of the Chief Operating Officer, Finance and Research Officer, Communications Officer, or IT Officer is terminated. Provide to the board quarterly financial reports. Inform the board if expenditures are expected to deplete reserves below an amount necessary to run the exchange for 15 days. Ensure proper procedures and audit protocols are in place to ensure financial transactions are secure and reconcilable. Provide to the board final audits performed by outside agencies and vendors. At the onset of the request for proposal and request for grant application process, bring to the board the basic concept of the RFP or RFA. Solicit the board to request participation of a board member to participate in the creation of the RFP or RFA, and solicit the board to request participation of a board member to participate in the selection committee. Inform the board of any contract or contract amendment that must be placed on an agenda of the board of examiners. Keep the board appraised of the performance of all vendors. Submit for the board's approval draft reports that comply with the requirements of NRS 695-370. Submit to the appropriate entity any reports required by federal or state law or regulation. Ensure the necessary security protocols are in place to ensure the security of federal tax information, personal health information, and personally identifiable information. 1 week prior to the due date of comments for federal regulations, provide a copy of the comments to the chair and vice chair for review prior to submittal. Submit to the appropriate federal agency comments regarding preliminary regulations as necessary. And that should be a period.
I'll open it up for questions or comments. Ms. Atkins?
Lynn Atkins for the record. I think just 2 comments. The C, where it says the executive director shall, we need to put some sort of language in here that it's including but not limited to as well, because I'm sure you do 15,000 other things, because you have that language in B.
We can certainly do that. I think the idea was it's included in meeting the goals and policies of the board, but
or then just a little bit more broad language, I just would say, because this just
I would agree.
So I just that. And then the only item in B that didn't seem to have a corresponding section in C, and it seems to have been an issue that's come up a bit over the last few months, is the number 7, the negotiation and execution of MOU.
Mm-hmm.
There's no kind of, well, the board will then review or approve or comment or something.
So we could, typically memorandums of understanding are signed between directors of state agencies. There are going to be requirements that the exchange sign MOUs with the federal government for data sharing and security agreements. And we could bring those to the board for their review.
I think I'm talking about what I think the issue that's come up is more about just Nevada state agencies as we're trying to figure out our way through this and who's responsible for what, with Division of Insurance, with us. And
Directors of state agencies don't report to a board, and you do, so it would seem appropriate that those things come to the board. We certainly deal with more trivial things in an MOU, so I think that would rise to that level.
Okay, so do you want MOUs to come to the board for approval or for review? I mean, typically when we're signing the MOUs, or if we've got an agreement with another agency, it's in following the policies that were approved by the board.
I think we'd like to know, again, there's a lot of overlap between Division of Insurance, Medicaid, Exchange, HHS. It just seems like the board being aware of where you have negotiated those overlaps seems like something that's relevant to what we should be doing.
Okay. would you like it to be a review item or an approval item for the board?
Approval.
I would think approval. I mean, can you describe some other, I think we're all most familiar with the one interstate with the different agencies. I think that's the one we're most familiar with because we've looked at and talked about and have had a few issues just come up trying to figure out who is responsible for what. What are some other MOUs that we have been entering into?
We have not entered into any yet.
Oh, okay.
An example from my previous job, the director was responsible for collections of premiums and claims costs when they were inadvertently provided to an individual. The controller's office began to conduct a centralized effort for collections. It didn't quite make sense for the collections for our services to be there because they're dealing more with collections for driver's licenses or taxes and things like that, where ours were based on claims and could be done in a different manner. So the director signed an MOU with the controller's office to make sure that the collections was done appropriately, et cetera, all within the bounds of what his job responsibilities are.
So I would say, this is Lynn Atkins again, I would say since there's really just one MOU that we've entered into interstate with the agencies and we're not sure what other MOUs we might enter into, I would say for now that those should be brought to the board for review and approval. And then if we see that there's just so many that we don't have, I don't know.
They're immaterial.
Yeah, but I think we don't know yet. And I think there's some of those things that I think some of us would like to know.
So I'll add 6D. Bring to the board for approval an MOU or something to that effect.
Yeah, reflecting. Those are my two comments.
70 or 60?
60.
7.
60.
60.
Under contract management.
Oh, I'm sorry.
And I think we'll add at item number 10, the executive director shall do any duties necessary to ensure the smooth operation of the exchange.
All right. Any other comments? All right, then, John, I have a couple. Under section B, and it's number 8, interpretation of the Affordable Care Act. Do you think it would be appropriate to, and I'm just using words, so use whatever other words you want to, in conjunction with the Attorney General, since some of this may be legal interpretation?
I don't necessarily intend to interpret the ACA without my attorney. So we certainly add the DAG. I pulled this strictly out of other directors' responsibilities that said that they would interpret their federal governing law and the state governing law, but I could add in conjunction with the Deputy Attorney General.
Well, I think that helps protect you a little bit too.
Sure.
The other question that I had was under section C, dealing with the press. Do we want to have the term transparent anywhere in that? I mean, that's been something that's been really important to us since day one, and you certainly have implemented it in the website.
I just think the term is so over.
Do you think it's over?
I think it's
overrated? Okay.
Yes, that's just my personal opinion. Perhaps it should be there.
Lynn Atkins, on that same one, I guess I did have a question and then I decided not to ask it, but on the same one, the press one, the maintain Nevada's leadership position in exchanges. Are we talking nationally? Is that the idea behind that?
Yeah,
I'm not sure what that means.
I would say that we are in a certain position in our implementation. We are keeping on top of the regulations, on top of industry standard, on top of what's going on in the rest of the country. And I think it's important that we don't alienate anybody and that we don't paint ourselves in the press in a manner that is contrary to what you would expect of this position. You could just change it to say do good.
I mean, I'm wondering just, again, Lynn Atkins, to address the chair's question, you could say in a clear and open manner or something instead of using the word transparency or something. I don't know. Or clear and,
Yeah, clear enough. And
I don't know.
Clear, right.
Open and
Yeah, transparent.
transparent. Yeah, but Ms. Lewis is right. It is a very overused term. But
Yes, I agree. I think if John proves himself unworthy, we can bring him to,
Bring him to
I
task.
don't know if we have to,
So what I could do with the board's direction or approval, approve all the language we have in here so far, bring back the new things that you've added as a new item on here at the next meeting so that you can say, yep, that wording looks good, and move on.
Let me just ask one other question, if I might. And maybe I just don't remember seeing it, but in most bylaws, do you have the detail of the evaluation in this step?
I don't know if it's bylaws or policies and procedures.
That's what I was wondering, is it
but-
belong here in policy and procedures?
Again, I can only reference what I know from my previous job. They didn't have bylaws, they had policies and procedures, which basically did the same thing. We could create a new document if you'd like.
No, I think what you've done here is great. I just was surprised to see the detail of an evaluation in quote bylaws. Usually you see it in an underlying document somewhere. But
Certainly putting it in, this is the one word, putting it in the bylaws does not leave you any leeway to deviate. Usually you're not expected to deviate from the bylaws. So.
well, but bylaws can be amended anytime the board
They can.
chooses to
That's true.
amend them. So I'm just putting that on the table for discussion. Any other comments from board members? Okay, then I think you have the few changes that the board would like to see changed. Do you want to approve it contingent on those changes, or does the board want to see it back at the next meeting?
this is Lynn. I would say let's wait and see it next meeting and then just approve it. Or
That's fine. So I'm going to remove all the track changes that you see here and include the new items that we discussed in track changes, so that calls out the new items. Will that work for you? So it's really clear what we've talked about here?
Okay.
All right, so we'll bring this back next month.
Okay. All right, going on to agenda item number 7, updates to the strategic plan. And I think Mr. Haycock's going to take that for us.
Thank you, Madam Chair. For the record, Damon Haycock, Finance and Research Officer. This report is to provide an update to the strategic plan, specifically revising the outcome measures for goal number 5. The draft strategic plan is provided as the attachment 7A. And the changes that I can draw your eye to immediately are page 1. You'll see that the updated date will reflect today's date if you approve these recommendations. And then finally, on the last page, page 9, you'll see under goal number 5, near the bottom of the page, we've shown with red strike through the old information, and we've shown in blue italics the new information. And the reason we are recommending a change to the strategic plan is twofold. When the strategic plan was originally developed, we weren't 100% sure exactly how everything was going to turn out and what measures to assess against the exchange's success. One of those measures was that the time to determine simple eligibility scenarios is less than 15 seconds. After research and discussion with CSIO and their upcoming reporting requirements, it appears that they are going to require from the exchange that we report on the amount of new enrollees becoming eligible in the first enrollment session, and then how many of those enrollees are eligible in the subsequent 7 days. So we wanted to try to tie up the reporting requirements with the strategic plan and recognize that the 15-second simple eligibility requirement may be a little bit too aggressive and may even be impossible based on our requirements to utilize the eligibility engine with Division of Welfare and Supportive Services, and then also those issues that require additional documentation, specifically when an individual applies for Medicaid. Unless Director Hager has anything else to add, I'm available for questions.
For the record, John Hager, one additional item. So when we came up with these, I think a while back, I think it was more like April, May timeframe, we didn't even have Xerox on board. We, at staff level, kind of envisioned you go through a process, it pings off the Federal Data Hub and comes back with an answer, and we thought that the hourglass would be turning at that point, and we didn't know how long that would take. And even at the time, we were concerned that it could take 24 hours. We didn't know. The way we've designed this, there's actually several times where it will ping the Federal Data Hub. I think there's 3 or 4 times where it will go out, get an answer, come back. That ping is supposed to happen while you go to the next page. So you shouldn't be sitting there a long time waiting. It should be a smooth flow, assuming that the Data Hub is up and running, and there isn't the 24-hour wait time. It doesn't appear that there will be. The testing is going smoothly. We're in wave 1 testing, and we're getting the data calls back at this point. So that measure just didn't work anymore. These ones, like Mr. Haycock said, match up much better with what the national reporting requirements will be.
Okay. Do we have any other questions on this? Do we have a motion for approval then?
Just on my list, I move approval of the changes to the strategic plan.
All right. Is there a second?
It's Dr. Ford, I second.
All right. All in favor of the motion?
Aye.
Any opposed? Okay. All right. We're at a point where we can take, we're down for a 5-minute break. Why don't we, aren't we at that point right now?
One more item.
One more item?
Let's get 8 down first. It goes with the previous item.
Oh, okay. That's the line. Okay, we'll go on to agenda item number 8. The review of the reports that will be available to staff to measure performance of the exchange.
Okay, again, Damon Haycock for the record. As Madam Chair said, this is an information-only item. We wanted to share the different looks or the different types of reports that will be available for the board and for the public to see. These are specifically designed off of our strategic plan goals, as well as the CSIO performance metrics that are under development today. So a little bit of background. The strategic plan was approved on June 14th, and now a motion has been approved to update it as of April 11th. A little bit more on the performance metrics. There are a series of reports that CSIO is requiring of all state-based exchanges to submit to CSIO on a quarterly and annual basis. Those requirements have not been completely approved, and so when they are approved and developed and completely vetted, we will provide them to the board for review. In the meantime, we wanted to, of course, illustrate that the Business Operations Solutions by Xerox has a reporting function that can capture all the data elements required to develop the reports. It's being, like I said, developed with that reporting feature, and it can develop and report on standard reports and non-standard reports. So all of the strategic goals are going to be captured in a series of reports and presented in a dashboard for the board, for the state and federal agencies, and the public. This dashboard will be posted on the exchange's website and will report results annually, quarterly, monthly, and during the initial enrollment period of October 1st of this year through March 31st of next year. It will have the opportunity to report weekly and daily to gauge the operation and success of the exchange during that open enrollment period. So to draw your eyes, if you'll take a look at the attachment to this report, is a very beautiful dashboard that Xerox has put together. And it'll show what we expect to see on all the different strategic plan goals. You'll see that they have various bar graphs, and it's color coded. If you take a look at the first goal, increasing the number of insured persons in Nevada, as you can see, it's broken out by shop employees in green, private individuals in blue, and tribal in red. And if you don't have a color copy, my apologies, but it's very pretty. And it'll show the rolling monthly average and the total number of enrolled. Again, it goes through each of the goals, goal number 2 and goal number 3, and it continues all the way through goal number 5. So you can have a visual representation of exactly where the exchange is at any time that we report on that moment in time. Additionally, there will be, as I mentioned, some non-standard reporting, and those non-standard reports will support a lot of the information that goes into this dashboard, as well as can be utilized to assist in reporting to Societal on those soon-to-be developed performance metrics. These reports, these supplemental reports, are attached, although they are just the beginning and they are still under development. It is important to note that those reports and all of those data elements are not necessarily going to be posted on the website as they feed into the actual dashboards. It'll be an immense amount of data, and as needed, we'll be able to produce ad hoc reports. So if we get a reporting request from another agency that the board approves, or the board would like a separate report on any number of data elements, it appears that the Business Operations Solutions reporting function will be able to support that by performing ad hoc reports. So if there are any questions, I'd be willing to take them, and if you have any real specific questions on these dashboards, we also have members from the Xerox team here today to answer them.
Do you have any questions from members? All right. Thank you, Mr. Haycock.
And one item to add, you'll see the dashboard does not include goal number 4. Goals number 1, 2, 3, and 5 of the strategic plan specifically match measurable items from the boss. The items in number 4 cannot really be measured by the boss, so that's why you don't see those in this dashboard.
All right, we're going to take a 5-minute break right now. I'm going to ask everybody if they could keep it at 5 minutes, please. Dr. Ford has to leave at 3:30, and I hope she might give us 5 minutes more. I'd love to have the tagline and logo presentation done before she leaves. So if we can all go take a quick break and come back, we'll come back on the record. Which is possible action on developing the taglines and logos for the Nevada Health Link. And with that, we'll ask Stephanie Cruz. Well, Stephanie, why don't you come forward anyway? If you have questions, you can help address them too.
CJ.
All right, thank you, Madam Chair and members of the board. I'd like to introduce Rob Gadke of KPS3. We've been diligently working and doing focus group testing. He's going to lead you through some of the things that we've put together to develop a logo and tagline for Nevada Health Link. And with that, I'll turn it over to Rob.
All right, thank you. For the record, Rob Gadke. Can everybody see the screen on your TVs?
No.
But we do have the presentation in front of us.
They have it in front of them.
Okay,
Go ahead.
we'll assume I'll give page cues as well here. But essentially what I'm going to cover today is not only the process and all of the steps that led us here today to bring a recommendation for the logo, for the color palette, and for the tagline, but I'm also going to request that the board help us in determining the final choice of this logo, color palette, and tagline. So with that, I'm going to run through essentially the logo first. And I'm going to walk you through the steps here, what we did to get to where we are today, and ask that we hold comments until the end of the presentation, and then from there we can discuss and hopefully leave today with a approved logo, color palette, and tagline. So to get going, our first task for the logo was to establish a mark, a brand image here that embodies the mission, the goal, and the objectives of the Nevada Health Link.
Rob?
Yeah?
Robin, just for a moment, those that are online or board members, it is online. It's agenda item number 9, so those that are participating by phone can see what we're looking at. Thank you, go ahead.
Thank you. So step 1 in the logo development process, as always here, was to start with research. And going through the research, we tried to hone in not necessarily on the broad range of research, but really what drives a consumer in our market, in our demographic. What do they relate to? So we keyed in on, first and foremost, they needed a visual representation that was very clear and simple. We needed to make sure there was a sense of seriousness, but also bringing in a sense of community. There was some positive reaction to icons that had a sense of self, a sense of family and community, and also, as we've noted in several other pieces of research, any kind of reference to a connection, making a connection between us and health insurance was positive. On the not so positive side, there was a tendency to distrust the government. And so we honed that in, saying that the identity needed to be warmer and more personable. And finally, there was an idea that there was a certain light for brighter colors. So with that, we developed a first round that was provided to the exchange staff. And you'll see on page 5 here, all of the logos that were presented to the exchange staff only. And this was our first take on several different concepts. You'll see here that we explored some options revolving around connection. We explored some concepts directly relating to community and togetherness, as well as protection. And our last option, 4.1, we explored the idea of a brighter future. Based on feedback from the exchange staff, we decided to exclude anything that depicted protection, shields, and strong connotations here were excluded, as well as that last option for a brighter future. So with that, we narrowed our options down and delivered essentially 8 logos to the working group. This is the same working group that we've been working with in the past for naming and approach. And with this, we provided all of the options minus the ones that we stayed away from, and we had some very candid discussions. From there, the working group, the exchange staff, and KPS3 decided that we needed to add a few more options around link. So you'll see option 1.5, 1.6 are new additions to this round. And then likewise, there was a preference for a little bit brighter, a little bit warmer color palette. Now step 3, essentially our final 4 that we took to focus group to test. And we did our focus group study at the Cannon Survey Center, again at UNLV. We recruited the exact same demographics to make sure that we were consistent with our previous. And we were able to get 10 participants in English and 7 participants in Spanish. It was really a perfect amount of people to have a really lively discussion, at the same time not get into any kind of massive group trouble. So if you turn to page 12, in your packet, you will see the final 4 that we were presented, tested, and without question, it was pretty much a landslide for option number 2, that top right corner. And when I say landslide, I mean all but 2 in English and every single one in Spanish. And because of that, You'll see as I get down to our recommendations, but that one definitely tested most positive. There was also a slight preference in English for option number 4, the bottom right corner. However, there was also a few notions that had a serious negative reaction to that logo, and because of that, we feel that it would not be a strong recommendation. Let's move forward to the Spanish implementations here. You'll see we have the same color palettes, same logo options presented here. Again, mirroring the English focus groups, strong preference, 100% preference for option number 2. Just to give you a little bit of insight into the commentary that went on in these focus groups, with regards to option number 2, one of the comments was, when you have your big drive, you could see that all over the place. It just screams link. It's appealing to my eye. I like it. I like the colors. I see the connection between the health link. And going into Spanish, number 2 has everything. I would not change a thing. Together or united were the commentaries there. So that was the process that we went through for the logos. Again, we'll get into discussion here in a second. But now I'd like to move forward on the tagline. Again, same process that we went through for the logo. We did the exact same thing for the tagline, starting with research, and then moving on to our first presentation to the exchange staff. From here, again, like the logos, we explored specific concepts, exploring concepts around the link, taglines like your connection to affordable health insurance, community and diversity. We really rallied around that and came up with some taglines: ensuring ourselves, our families, our future, health insurance for every Nevadan, going through the protection side of things, securing affordable health insurance for all. On the brighter future front, insurance solutions for a better state of health. And then finally, we provided some options that didn't necessarily wrap around one individual concept. Those are on page 19 in your packet. One example here is find a plan that's right for you, the coverage you need, the plans you want, and a few different variations on those themes. So once that was presented to the exchange staff, we went in and fine-tuned these together and presented, if I can get going, on slide 21, we presented 9 tagline options to the working group. And from there, we had some strong discussions around terms like affordable. We had some strong discussions around you and your connection and connecting. And we ended up taking 5 taglines to focus group, both in English and in Spanish. You'll see on page 23 the 5 presented taglines: health insurance for a brighter future, your health insurance solution, helping Nevadans find health insurance, insuring ourselves, our families, our future, and finally, connecting you to health insurance. Each one had an equivalent Spanish translation, although because of our working group and several other input from the Hispanic community, we did have some slight variations on the Spanish taglines to make sure that the essence was there and captured. And you'll notice that number 4 is slightly different than the English version tested, but in Spanish that one translates to for our health, our families, and our future. As you can see on this page 2, number 2, your health insurance solution tested very positively in English, as well as option number 5, connecting you to health insurance. And in Spanish, it was, again, a landslide for number 4, with all participants voting for our health, our families, and our future. We have some candid feedback as well with regards to the English side. Your health insurance solution. There was a lot of English components here that people said this was quick, it was fast, it was easy. It was straight to the point, it was simple, and they liked it. Bingo, because connecting and solution is what you're looking for. To me, they grab you and they're right to the point. With regards to the connecting you to health insurance, again, very straight to the point, connecting you to health insurance. There was also this concept of honesty. I like that one, it's honest. This was in reference to another tagline. A brighter future is out of the way, it's more honest. The other one kind of assumes you'll have a brighter future or a future at all. It's telling you what you're going to be doing. Likewise, on the Spanish side, there was a lot of, ooh, that one, when they were on the board. Exactly, that one includes everyone. So a lot of sense around community and family, which is what the research had pointed to. Now, for our discussion, and I want to point out that it was 100% our intention to provide the board today with options for logos. However, because of the research and because such a strong preference leaned towards one, and the only other option that was a contender also had some very negative connotations tied to them, we are recommending one logo option here today, and we're hoping that we can get some guidance and some feedback with regards to the color palette and regards to the tagline options. So with that, I'm going to go and move on to the board's decision. You'll see here, what I'm going to show now are several variations of the logo we're recommending, and also showing you some examples of the logo in the wild. These are in no way, shape, or form what they will be. However, in an effort to help you guys visualize what this logo could look like in certain pieces of media, we're going to show you those. So I'm going to scroll through these, and then I'm going to come back to the page with everything on it and open it up for discussion. Logos and colors, and it's definitely best. These are being very washed out on the screen, so if you look in your packets, you'll see we're on page 27. 1.1 and 1.2 were logos that were tested in the focus groups, and 1.3 and 1.4 are a variation on those themes, still in the bright color palettes, still in the proper tones, so we feel that these would be great recommendations if the board chooses to pick a new one. As for taglines, the top two contenders for English, connecting you to health insurance and your health insurance solution. And on the Spanish side, again, because it was unanimous, for our health, our families, our future. You'll notice here too, the Spanish tagline does not have the term health insurance in it, and that is purposeful because it is in the name in Spanish. Health insurance is in the name. However, in English, it was very important to have health insurance in the tagline because it's not part of HealthLink. Now I'll show you a couple examples. If you turn to page 29, you'll see the logo set with the tagline. Again, this tagline will only ever live in the context of the logo. However, the logo may live outside of the context of the tagline. So here's some options with connecting you to health insurance. And on page 30, your health insurance solution. And in Spanish, for ourselves, our families, our future. And now I'm just going to scroll through a few variations of this in the wild, again, just to help give you a visual sense. An outdoor execution, bus signage. Again, we would have much more than this on these, but just to help give you a sense of place. A laptop. And this is a representation of the mark itself on its own. Again, we're not recommending this, just to help visualize what the mark looks in one color on a piece of collateral. So with that in mind, I'm going to go back to pages 29 and 30, if everybody can turn to those pages in their pamphlets. And I would like to open it up for the board's discussion. Again, understanding that the objective today is to leave with approval on a logo, with a chosen color palette and a tagline for the HealthLink. So with that, I'll open it up and turn it over to the board.
Rob, can I ask a question on maybe I'm jumping ahead, but on the Spanish translation, when you change the wording a little bit, or what is it, for our family, for however it reads out?
Yep.
Did you test that in the English version?
No, this one did not test well in English at all. Again, because it did not have the term health insurance in it. It was very confusing to the audience, so that one was not tested in English.
It tested, but it was connecting. No, for our. It's a slightly different translation in Spanish.
Well, my question was, when you made that change literally to the proper Spanish, I mean, the sound of it really flows nicely. Did you try that in English?
That literal phrase?
Yeah.
No. That was connected.
Okay.
The other versions.
And just to note, Rob Yadke for the record, we are recommending that the Spanish tagline be different than the English tagline, and we don't see that as a problem in any way.
Okay. Leslie, was that you trying to make a comment?
Not yet, Madam Chair.
Okay. I need to have people mute their phone, if they might, please. All right. Marie, do you have any comments?
Yes. Looking at page 29, I think the one in the far, in the 1-1-1 is my personal preference. 1-2-1 is not as bright, it doesn't wake me up as much. And the two on the bottom, the colors seem to, the color palette is a little odd. They almost seem to not match. So 1-1-1 really is my choice. And I do like connecting you to health insurance over your health insurance solution. I think it makes it goes very well with the chain links, and it sets forth the messaging that you're trying to show, that which is exactly what we do, is we connect consumers to health insurance. So, and for the Spanish, again, the color scheme, I like the Spanish translation. It jumps at me from the my very poor Spanish. It hits me. It hits me in the right place, and I like the color scheme with the. It works with 1-1-3. So that's my thoughts.
All right. Here.
Well, I prefer 1-4-1, but could go for 1-1-1, always have. I think 1-2-1 is cold. Blue and green all of a sudden is very cold colors together, and not very inviting. So, what's my preference? Oh, connecting you to health.
This is Lynn. I was on the working group, so I think we had a great conversation, and I think we're all really happy with kind of the choices of where we are. I like connecting you to health insurance best. I also think it describes really what we're trying to do. I think my color palette preferences are different. I think I like the two that are least liked by the rest of the group, being 1-2-1 and 1-3-1, but I am perfectly happy with 1-1-1. I think the KPS 3 folks have said it's, bold colors, good colors to work with. People can notice it, so I'm totally fine with that. But I think my own preferences go to the other ones, but I do see how they're a little bit more subdued. That's me.
Sure.
Dr. Klein?
Well, I'm not subdued. I look at the taglines, and I actually agree with Marie. I thought of your health solution, your health insurance solution. I thought of connecting you to your health insurance. Your health solution to me seems like it's a company, a single company saying, buy my product.
Yeah.
And connecting you to your health insurance, I think, better describes what we're doing. So I like the connecting you to health insurance better. I like the 1-1-1 colors. I don't know if this makes any difference at all, but at least for Southern Nevadans, the 1-2-1, I think those were the CenturyLink colors or Sprint colors a few years ago. That's just sort of what I looked, that's what came to mind. I don't know if that's a negative or positive thing, but that color scheme was what came to my mind. So
Okay.
I would go with 1-1-1, and then in Spanish, I guess, 1-1-3. So I agree with reset.
Yes, I'm the last board member. My favorite, just even looking at it, was 1-1-1. And I do like the connecting portion of it. And then in the Spanish, I like the 1-1-3. And then we have one more board member on the phone, and I hope Leslie's been able to see this online.
Yes, I can, and I also like 1-1-1.
And on the board like that color palette as well.
Yeah.
I
Okay, so I think we've got some consensus on the English version. Leslie, what's your preference on the Spanish version?
Well, I didn't really follow the discussion on Spanish. KPS was all right with a completely different tagline, was that right?
Rob Gatke for the record, that is correct.
All right, then I would go with the rest of the group on that one as well.
All right, does someone want to make a motion then?
This is Lynn Atkins. I move that we approve option 1-1-1 for the logo, color scheme, and the tagline, and 1- for English, and 1-1-3 for logo, color scheme, and tagline for Spanish.
Second.
All right, we have a motion and a second. All those in favor of the motion?
Aye.
Any opposed? Hey, I think we got it.
We can go.
Go fast. Well, I want to thank all of you for the work that you've done and the focus groups as they worked through it. I'm really pleased with
I want
it.
the basketball with the road.
I did like the basketball. Oh, soccer ball.
Thank you. Soccer and basketball.
They're gonna be little. Little tiny guys.
Okay. All right, the executive director has asked if we can move this out of sequence and move to item number 12. If we might, Mr. Hager, you want to go ahead with agenda item number 12?
Sure. For the record, John Hager. Agenda item number 12 talks about the contribution and participation rates. If you'll recall, last year the board approved a recommendation that creates the employer-employee choice options. One was an open metal tier, which was required to be provided by the exchange. One was an open shop option, and one was a package plan. A little bit of background. Recently, the federal government has indicated that the open metal tier is no longer required. It's optional for state exchanges, and that the FFE would not be having any kind of employee choice. Rather, the employer will choose one plan, and the employees will get that plan and that plan only. I think they've determined that the premium aggregation function and the selection was too difficult to build. That's the feeling we get from it. We don't know for sure, but that those options would not be available to people that are on the FFE. For those on state-based exchanges, they had given the state-based exchange the option of having employee choice. I would say that we go forward exactly like we're doing. We've told everybody that that's what we're doing. I think nearly every state-based exchange in the country, if not all of them, are already going forward, have planned on it, and are moving forward to provide that option. So I wouldn't recommend changing that. But when the next recommendation was regarding participation and contribution requirements, that we have at least 75% participation and 50% contribution required from the employer. We had to standardize that across carriers for the options that have multiple carriers. So an open metal tier or an open shop plan, because you have multiple carriers, you have to have standard participation and contribution rates. So therefore, we had to standardize that. And we took pretty much the industry standard of the employer contribution of 50% of the lowest cost QHP available to employers employees and a minimum employee participation rate of 75% to eligible employees. We have found it difficult to administer, and so let me back up. The package plan, to mimic today's market as closely as possible, we recommended that the carriers select their own minimum contribution and participation requirements. We found it difficult to get that part of it up and to have the carriers select that. It would be much easier to create a standard 50-75% across the board. And so the request here today is to request to go back on that decision and standardize it completely across the board. Now, those minimum participation rates obviously is a minimum. So if you have 10 employees, you have to have at least 8 employees participate if there's 10 eligible employees. On the contribution side, again, that's a minimum for the employer to contribute at least 50%. That mitigates adverse selection, makes sure that you've got people on the plan, that you're not losing people because it's too expensive for them. So the 50% contribution typically minimizes adverse selection. That is the minimum. So an employer could choose to contribute up to 100% of the employee's portion. They can decide to contribute a portion for dependents all the way up from 0 to 100%. Spouses separately, dependents and spouses in one category, and then domestic partners are separate because of the Nevada Domestic Partnership Act that requires that employers that says that coverage for employers, for domestic partners of employees is optional. So we want to make sure that the employer still had that, the employee still had that option, the employer still had that option. So that group is separate. Of course, that's contingent on the Supreme Court case that was heard a week or two ago. That could change, but as of right now, those are separate. So the recommendation of staff is to standardize that across all employer-employee choice options so that it is a minimum 50% contribution rate, minimum 75% participation rate.
I guess I would ask Ms. Kerr, since you chaired this committee, what's your feeling on this?
I think.
Can we reach back to the committee on any of this at all?
No.
I think that it actually, I think it is an appropriate recommendation from staff. It preserves the status quo. This is essentially what employers have come to expect when they purchase a health insurance plan. It's what the carriers expect to see, and so we're not seeing, we're preserving stability, we're preserving the status quo, and I think it's a good idea.
I'm not sure I understand. I think I lost you after, now we're going to talk about agenda items.
I lost you on hello.
Go back over the original.
So I never even realized it. So when a small business wants to participate, they have to participate at a certain contribution level, a certain membership level, or they can't participate?
Correct.
I don't think we do that.
So if I'm an employer and I go to an insurer, they say, okay, the premium for each of your individuals is going to be, say, $400. You have to contribute $200 a month for each employee. And then once they set that, now you go to the employees, your contribution will be $200 when you like to purchase. And if you don't have at least 75% participate, they say, come back when you can get 75% participation. Or why don't you raise your contribution rate to 75%, so you pay $300, the employees only pay $100, and now maybe you'll get better participation rate. The idea is that if you don't provide enough contribution, employees won't select coverage, and the employees that feel that they're healthy won't select coverage because it doesn't make a difference to them. It's the idea is you want to get the healthy employees in the risk pool. And so if I'm a healthy individual and I only think I'm going to have $600 worth of medical expenses over a year, but it's going to cost me $1,200 for premiums, why bother? Now we obviously recognize that insurance is meant to cover those catastrophic issues, but that's the thinking that would go on, and so it basically protects the carrier from adverse selection and premium cost down.
Why do we care what percent? Okay, I understand that portion of it. Why do we care what percent the employer contributes as long as they have a certain percentage of people participate?
The employer cares.
Standard in the industry, for the record. For the record, John Hager, the standard in the industry is typically 50%, and that typically gets you to 75%. It perhaps doesn't make, I don't know, that's just the industry standard.
Okay. So sort of along Marie's point is that it keeps the status
That
quo, so
is
change
Leslie.
doesn't look positive.
Yes, Leslie?
I was under the impression that with the community rating approach that is going to be required under the ACA, that the minimum participation rate would be less significant at an individual employer level.
Can somebody repeat that? We couldn't hear it very well.
Leslie, could you repeat it? I couldn't hear you very well either.
Okay, I was under the impression that because the carriers will be rating it by rating area, that the percent participation for any individual employer would be less important.
For the record, John Hager, it's difficult to say. Certainly with the community rating, I think the concern is while you have community rating, if you were to eliminate the participation requirements, you can still have people that decide to pay the tax penalty rather than get insured. And so the idea would be you still want to have the healthy people into the risk pool. And so while it may not be an issue for an individual employer, I think it will affect the carriers on an aggregate basis.
Okay, I think if we do this, I think it's just going to minimize the number of small employers that enroll now into the shop compared to maybe what we were hoping for.
What was our proposal before? I mean, what's the change on it?
I would say that if we were to eliminate the 50 or 75%, I do think we could significantly affect the carriers that participate. But what's changing is in the package option, where an employer has the option. Let's say let's say an insurance company says, I want to provide in package A plans 1, 2, and 3. Right? Similar to what happens today, you get one plan or maybe 2 or 3 plans for your employees, all from one carrier. That preserves what's currently offered in the market. And the idea was, let's make things match closely to let's have an option that matches closely to the current market. And currently today, the carriers decide contribution and participation rates. While most of those are at the 75-50% level, there might be some deviation. The problem that we're having is that it's difficult to administer a different amount. And so we'd like to be able to set across the board what we've already set for the open shop and open metal tier, just make it standard across the entire shop exchange, 75% participation and 50% contribution. It wasn't really our intent to change that for the open shop and open metal tier. Our intent was to require that all plans adhere to the same standard, whether it's in the open metal tier, the open shop, or the package option.
And the 75% participation rate, if you did the package, would be adding all those tiers up to come to 75%.
It's 75% of the employer's eligible employees.
No matter what tier they
Correct.
select.
It's based on that employer.
This is Lynn. So Leslie is suggesting that utilizing this method may prevent small businesses from joining.
Leslie, do you think it's the percentage or do you think it's a contribution?
Yeah, I mean, I can see the carrier's point of view, but I would just make sure the group understands that I think that's going to minimize the number of small employers that will sign up, because getting the participation and that high of a percentage contribution from the small employers is going to be difficult.
So do you think it's the percentage contribution that's the more important criteria there, or the percentage of employees participating that's the important criteria?
Say that again?
Of the two criteria we're talking about, which do you think is most relevant? Because I guess personally, I think that if you get a percentage participation, it doesn't matter how much you contribute. So that's my uninformed opinion. What do you think?
I would tend to agree with that. It's because now we've got the individual has some responsibility to get coverage for themselves, and so the participation might be a little bit easier because of that rule, but getting a high percentage contribution from the employer is going to be difficult.
I'm not an insurance person, but I mean, I understand the issue of adverse selection and whether it's 75% or 50%. I mean, I can't comment intelligently on that. But I mean, I hate to hear my laissez-faire free market kind of guy. But it's ultimately up to the insurance, to the employer, how much he or she contributes, as long as he can get to that 75% or 50%. I don't know what the right number is there.
My concern about changing it now, the carriers are already reading their plans. We've been out in front. There's a few things that we're tweaking now. Major changes, and I think this would be considered a major change, that we're going to create some destabilization, and my recommendation would be simply to standardize the package plans with the 75/50 that we already approved for the shop and open metal tier plans.
So we've already done it.
I understand. So we've already approved it for shop. We've already approved these numbers for the shop. So what are we adding to this? I'm missing that. I'm sorry.
So the recommendation, we provided 3 employee-employer choice models. An employer goes to the exchange and says, I want to choose an open metal plan. So I'm going to choose silver plans. My employees can choose any silver plan in the silver metal tier. Because there's multiple carriers, you have to set a standardized rate. And so we chose 75/50. Open shop, same thing. If a carrier designates a plan available in the open shop because they want to, they think that their marketing purposes, I think that I'll take on the risk selection that might occur because of a Bronze United plan versus an Anthem Platinum plan. I'll take that because I want that market. So I'm going to designate a plan in there, and we're going to have a standard contribution participation rate, 75/50. On the package side, we tried to mimic what's done today, which is you go to a carrier, you have a selection of one plan. If the employer has multiple selections, the employees have one plan or 2 plans, maybe 3 plans, and the employer and the carrier creates the minimum contribution and participation rates, typically. Now, the 70/50 is pretty much industry standard across the board. There might be a little bit of deviation, but not much. We wanted to entice some of the insurers that might have a little bit difference of opinion on that to allow them to come over here where they're in the package option where they can vary that a bit.
What's the package option? I don't understand. Supposed to be open tier versus the.
So if an employer wants to limit selection to certain plans, either limiting their risk, their premium amount, if maybe they've got a really small group, they just want to, they're comfortable with these plans, these carriers, it would mimic what's done today. So today, I'm an insurance carrier, I come to you, I provide you with, here's 2 plans from United, or here's 2 plans from Hometown Health. And you say, that looks great, I like that package, or I like plans C and D over here. You contract with me, you pay me a check for whatever enrollment happens in those 2 plans. The employees only get to choose from those 2 plans. And so we were trying to say, you know what, maybe a carrier wants to have a different contribution and participation rate for the package option. Because there's multiple carriers in the open shop and open metal tiers, we had to standardize it 70/50. We had to standardize it. We chose 70/50 to preserve the current market status. It's an industry standard. We're finding it difficult to administer a potentially different participation and contribution rate by carrier, and so we'd like to standardize that piece of it to match what we already.
This is administrative. You can't. It's not for any. Let's say good reason. It's not for any reason in terms of the thing. It's because administratively, computer-wise, you can't administer all the different variations.
Nothing is impossible.
Yeah.
But with time and money.
Yeah.
With time and money. But it will be difficult to administer, and we don't see the gain in offering that flexibility so important that we try to program that flexibility.
Lena, I think I have a question. So in this arena, if Ms. Johnstone's correct and we don't get enough small business participation, what is our ability to change these rules, and when could we do it? I mean, I guess I always want to know that answer, because we're doing so much that we don't know what's going to happen, and we're just hoping, and we're basing it on experience and everything and what we know. But
so what I would say is these types of things should be reviewed on an annual basis, and so all the recommendations we provided, the policy, the things should be reviewed maybe at different times depending on what the recommendation is. But I do think that we should look at these on an annual, at least every 2 years. You would want to give the carrier sufficient time to build it into their rates and consider it. Now, in future years, the plan certification process and the onboarding process won't take quite so long. So this decision could be made for 2015, perhaps in an April-May timeframe. Just given the time frames we have this time, it's a little bit too late, I think, to be doing that. And whatever else, it must not be that important. There was an intelligent thought there, but go on.
Any other questions or comments?
This is for Marie. As a small employer, you know, I certainly would rather not pay anything. But the fact is, this is the law, and this is what we have to do. If I'm used to doing things in a certain way, and I'm used to the 50%, 75% formula, it's really not going to have an effect on me. If you change it, it'll have an effect on me. If you don't change it, there is no reason for me not to join the shop, especially if I can see some benefit from doing so.
One thing that the intelligent thought that I had found is, so if you've got 20, let's say you have 20 employees, and the 50% contribution is too expensive for you, those employees can still go to the individual exchange, and the small employer does not have a penalty. Right. So there's still that possibility.
So coverage is available one way or another for those individuals.
So this is Ron Klein. I would move that, help me make sure I say it correctly, that we adopt the same standards for the package plans as we previously adopted for the other shop plans, with 75% employee participation and 50% employer contribution. Perfect.
Is there a second?
Second motion. One voice.
Thank you, Ms. Lewis. All in favor of the motion?
Aye.
Any opposed?
This is Leslie. I'm going to oppose it.
Okay. So we've got Ms. Johnstone opposing. With that, the motion does carry. All right, now we're going to go back to item number 10. Is that where you want to go next?
So, agenda item number 10 is regarding standalone adult vision plan fees. We met a small roadblock about a week and a half ago. CMS guidance, question and answer, that said exchanges, state-based exchanges could not offer standalone vision products, even though we have said that we would, even though our blueprint, as approved, said we would. So there's been a lot of flurry of discussion among the various state-based exchange directors on what to do about this. Some say, you know what, we're going forward anyways. They already approved our blueprint. Some say we're going to reevaluate. I don't know what the right answer is. I lean towards saying, you know what, they already approved our blueprint, let's move forward. The problem, of course, is that it was guidance from CMS, and I think, I'm not a lawyer, but statutory construction, they have the ability to interpret their own regulations and statutes or something. I don't know exactly how that works, but
We're just trying to read their mind. My guess would be that they would want as many plans on the exchange as possible to help people get it. So what was the logic? Not the federal government has to have logic, but what was the logic?
So I think there are two things. One item is that there is a section in the ACA that says that only qualified health plans will be offered on the exchange, but there's a specific exception for dental. I think the intent of that section was to say you shouldn't be offering these, mini medical plans or these things that don't cover the essential health benefits. And then the other side of that was grant funding was made available for creating exchanges. And other products are not necessarily in the law, and so I think there could be a conflict with that. So a couple of items. First of all, we're not providing our supplemental products to anybody other than those who have enrolled in qualified health plans. You have to get essential health benefits. The idea is to get people insured in quality coverage first. And now here's some supplemental products that will complement what you purchased. So that's the first part of that. The second part is...
So they're really not standalone, they're riders.
They're riders in the fact that they are additional products. Typically a rider is connected to one specific plan. But so I would say they're supplemental products, but they aren't purchased by themselves.
So your point would be that logic of you have to buy a QHP would include buying supplemental products.
Yeah, optionally, yes.
So this is Lynn. So if my company did not provide me vision coverage, I could not go to the exchange.
The primary member is a qualified health plan member. So that's the first part. The second part is on the funding. Creating the process for the dental plans is pretty much the same as creating the process for the vision plans. If I create a page to offer dental products, cut and paste and replace dental with vision, and it's not quite that simple, but pretty much the same process. We never intended on creating or calculating the advanced community tax credit based on the vision plan, on the adult vision plan. The pediatric dental is included in the QHP already. And then as far as administration in the future, it's a pretty simple, select that plan and move on. Billing is part of the same bill, so the incremental cost is, I would say, negligible, and we're going to get some revenue on it. So I think the revenue that we would have gotten would have covered the cost of administration. So the question is, do we say, you know what, we already have a blueprint approved by CMS that says, go forward, or do we say the new guidance is, X, and we don't offer the vision products? The other way around.
I'm sorry, you can still offer dental?
We still offer dental. Dental's allowed.
So you can offer. So CMS says we can offer dental. That's not effective.
Correct.
We can offer to pediatric vision as part of essential health benefits.
Correct.
So really what we're talking about is adult vision.
Yes.
That's all we're talking about.
Correct.
Haven't we paid for that to be incorporated into the planning of the systems and everything already?
Technically, yes. It was prepared, was specifically included in the contract, but there weren't any concerns about it as we went along in this process. So Xerox is expected to build it. The other possible way to offer it that the guidance says you can offer it is that you find another state agency that has the authority to offer it and cost allocate to them, and then the revenue would go from us to them and back to us again, which just makes it even more complicated.
What are the majority of your state directors saying? Are most people caving, or most people saying we're going forward?
I don't know what the majority are saying. I've heard both sides. At this point, we could go forward as is, and I could pull the other directors and find out what we're bringing back next
What's the worst that happens? The federal government shuts down the adult vision part of it and says that way?
Or they say you're not certified and you can't offer it. I can't imagine that that's going to be this is such a small issue. As long as we're not charging the APTC, we've got revenue coming in for it. I don't know what the implications.
Do we table this for another month, or do you need to know something now?
What I was hoping to do was to say, assuming that we do offer this, let's set a fee for it. Again, this is contingent on our statute being changed, and then we have to go through the regulatory process. And so we've got documentation here that shows how we change the regulation. We still go through the workshop and hearing process. But I would like to be able to envision carriers something to say, all right, this is what we're going to cost it at, so you can start moving forward. And our intent right now, we think, is to move forward. We're just not sure, and they understand that states across the country are still trying to figure this out.
John, you know, thinking worst case scenario, we say, what the heck, go ahead with it, and CMS comes out and says, no, you can't do that. Where does that leave the people we've signed up? You know, assuming that they tell us a long time from now, after we've signed people up, where does that leave them? And how would we mitigate that situation?
There's a testing and audit process that will occur before open enrollment. So we can, if we need to, we can turn it off, I think. Before it affects anybody.
So my motion, then you could turn it off at that time.
Correct.
They made the decision that it was inappropriate.
Correct.
You know, my feeling is that we continue down this path, and if we have to yank it, we yank it. But that would give you the opportunity of going back to CMS and tell them it's already attached to a qualified health plan and to create an exemption for you.
We're looking at this, Lynn has brought the CMS website here. So I guess the question would be, is it different, is there an answer that says no? Is it different if only the person who's buying QHP can purchase it, as opposed to anybody can purchase it? Do you have a different answer?
There's no answer to that question yet.
Okay.
I mean, I think we have valid reasons to move forward. I mean, I can understand where they provided that legal interpretation. However, I will say that's not regulation, it's not statute, it's Q&A. It's a tough position. I mean, and it's also frustrating that they're providing this information to us so late in the game.
So maybe, you know, go forward, try to get clarification to see if by limiting it to people who've already purchased a health plan, that changes the answer. Can I make that as a motion?
I think you can make any motion you want.
Okay. Yes. Well, certain ones are not appropriate. Okay.
We would expect that.
So I would move that staff move forward with standalone adult vision plans at this time, and seek further guidance from CSIO regarding the fact that the standalone vision plan, adult vision plans, can only be purchased by people who are purchasing a QHP.
Maybe we have a second to that?
Marie Kerr, second.
Okay. All those in favor?
Aye.
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 Any opposed?
Yeah. And we still need a motion regarding the payment for it, right? The cost.
That would be great.
I should move forward.
And that was.
Okay, so you're
Move forward includes figured out, John.
Thank you, I appreciate that. I think this one, it would be helpful. So the methodology that we provided to create the potential fee for the vision plan of 24 cents per member per month was the same methodology we used for the dental plans. So I would appreciate it if we could tentatively approve a 24 cent per member per month fee for vision plans, contingent on statutory authority at the state level and the final regulation process.
Okay, and Ms. Lewis, do you want to second that? Or? Okay, all right, we got a motion and a second to approve the structure of the fee. All those in favor of the motion?
Aye.
Any opposed? All right, motion carries.
And just to be clear, we'll bring back the regulation and the normal regulatory process with a adoption for the regulation and adoption for the fee for official, to be official.
And then moving on to agenda item number 11. This is one that you did want to pull, but there was something we wanted to talk about.
Ms. Atkins had a discussion about the credit cards. So where this generated from, we had already gone forward down the path of charging accepting credit cards and charging convenience fee for their use. The two bills came forward that we're looking at going, wow, how are we going to get past this one? This is interesting. And We had a lot of discussion again at the staff level, how to do it. We do it this way. We pass it through to the carriers who are already accepting those fees. Do we absorb it in our rates, which gets passed on to the carrier but is not included in the MLR calculation? And what we decided, I think we just need to let it go forward as it is for a couple reasons. The primary of which is we have already sent a message to the carriers that this is how we're going to do it. And if we want to change it, if the state law changes, there's only so much we can do. We have to deal with that. But I think we want to make a change that is probably not appropriate now at this point for 2014, but we could consider something or bring this back for 2015. So for that reason, I would say that's my report. And if there's any questions.
Right, so Lynn, so I just wanted to see something from Xerox. When you get to the end of your process and you're about to click purchase, or I sign up, and here's how much, I want to see where it's going to be, what the additional convenience fees are they going to be charged, are people going to be charging their insurance monthly, are they going to say, I want to see what the disclosures are going to be and the transparency of it, and it's very clear, there's no hidden fees, there's not an extra dollar.
No surprises.
Yeah, so I'd like to see what a consumer is going to see and where in the process they're going to see it so they can make the decision of using a credit card, electronic fund transfer, paying cash.
Are there any other disclosures or things that you'd like to see in the website for approval?
Gosh, what a big question. I don't know. I mean, I think we've also talked about, I'm not sure how far along they are on the website. It would be great to have kind of an updated demo. So we can kind of, I think I won't know what questions or what information I'm going to want until I see something and I kind of say, wait, this is missing, or where's this? It's just very hard in the abstract for me to come up with stuff I want to see.
Well, let's talk about bringing it back.
Yeah, so there are 3 demos on the website right now that you can basically on YouTube you can look at. They are basically using the product that you saw in last summer. The way that they're doing the programming, a new demo will be available probably in August. We'll be able to go through a lot of those discussions. We can probably bring back for you a mock-up of specifically about the credit card fees. Earlier than that, I can't say how early, but we can bring that back.
I think your point's a good one. I think you don't want somebody to say, well, I didn't realize I was paying you convenience fees. So, even one of those, like when you open up software that says, click I agree kind of things, say, I understand that by paying for a credit card, there's an additional $6 fee and whatever.
We have a whole team of people working on this to make sure we've got all of the proper disclaimers. We've got lawyers looking at it. So.
But it's also a misunderstanding. Yeah, it's also a misunderstanding. I mean, I think if somebody has a click thing that says, I understand I'm paying a service fee, and click yes, then I think regardless of whether it's legal or not, from a PR transparency standpoint, you said that
Clarity.
Clarity. You said that people acknowledge that they're paying for it.
All right, then if we're done with that part, let's move on to the quarterly reports.
This one, we can do them verbally if you like. But all the information is there, so it's up to the board whether or not you want a verbal report or just see it there.
Does anybody have any questions on these reports or doing a verbal report and have the opportunity of reading through them? I'm not hearing a request for a verbal report. Let's talk about discussion and possible agenda items for other dates.
So the board calendar is in agenda item number 4. In May, we're going to bring back the Navigator Enrollment Assister grantee organizations. And I'm sure there will be a plethora of items to bring back at that time as well. But for now, that's the juicy bit.
Okay. Do any board members have any requests for any other items to be on the agenda in May? Okay, thank you. And we'll open it now back up for public comment.
Do we have any public comment in Carson City?
Nope.
Okay, thank you. How about here in Las Vegas? Or North Las Vegas, I'm sorry. Okay, anyone on the phone line?
No, thank you.
All right, well, I want to thank everyone for your participation, and thank you, everyone in Carson, for fixing the video conference so we could hear. I very much appreciate it, and thank all the board members for their participation and preparation for today's meeting. With that, we'll adjourn.